Hello, everybody, and welcome to week 2 of long-term care lectures. I have two videos this week. The first video is a video reviewing the F-tag we're going to talk about this week, but I wanted to give, as I said in my prior email last week, and hopefully you've already watched the introduction video, an overview of long-term care and the pharmacist's role as consultant in a more updated version. The F tags, which are basically the what Center for Medicaid Services, when it comes to traditional consulting pharmacy required by law is applied to skilled nursing facilities. Here in the state of Pennsylvania, I might have mentioned this in our very first lecture of this semester, there is no laws and regulations for pharmacist reviews in personal care homes and assisted living. Different states may have those rules, but here in Pennsylvania, we really only abide by skilled nursing facilities. And if a skilled nursing facility receives Medicare and Medicaid funding, they have to follow the nursing home regulations that are required. And nursing homes are surveyed at least every 9 to 12 months by the State Department of Health in conjunction with the Center for Medicaid and Medicaid Services. And that is why the rule is out there for a pharmacist has to review the charts in a nursing home on a monthly basis. I gave you the F tags last week about medication regimen review and pharmacy services, and over the years those F tag numbers change. And one of the things that I'm going to share with you is some of the videos that I show you will be a little bit older, but they're still applicable to today. And so instead of retaping them, I still want you to watch them. But every week, if it is an older video, I'm going to give you an introduction. And the last lecture before we go to our live lectures later on this semester, I kind of do a summation of all the regs. So FTAG 329 is an older FTAG we're going to talk about today, but really what FTAG 329 is about unnecessary drugs. But in the FTAG world for Center of Medicare and Medicaid Services, it all falls now under, which just was updated about 2 to 3 years ago, under FTAG 483.45 pharmacy services. And basically, it basically says the facility must provide, routine chronic medications and emergency drugs, and they have to be obtained under a license agreement with a pharmacy and have to follow state pharmacy laws. And so we talked last week about the one component of that, and that's the drug regimen review. This week we're going to talk about the unnecessary drugs. And what will we be talking about in the prior lecture? In the lectures next week, we'll talk about the pharmaceutical service side of the delivering, the dispensing of the medications, evaluating med errors, and storage and supplies. But all of these rules and regulations, as I said, come from the Center for Medicaid Services and fall under pharmacy services. What's required, as we talked about last week, is CMS requires that the medical records be physically reviewed by the pharmacist in at least 3 situations: when the resident is brand new to the facility, when a prior resident returns or is transferred from a hospital or other facility, so, following a transition of care discharge from another place, and also during each monthly drug regimen review when the resident has been prescribed or is taking a psychotropic drug, an antibiotic, or any other drug that the Quality Assessment Assurance Committee has asked them to look at. So the pharmacist is going to be reviewing the chart every month, but there also might be some target things that they're going to be looking at. And we're going to talk about in the lecture you're going to watch, FTAG 329, about psychotropic drugs, and we're going to talk a little bit more about that later on when we talk about quality indicators this semester. But the rule dictates a review of the medical chart each month for every resident is required by the pharmacist under the law for Medicare. The other thing that we're going to talk about tonight, and this used to be formerly called FTAG 329, and so when you watch the video, you'll be seeing a reference to FTAG 329, is that the pharmacist must make sure the patient's drug regimen is free from unnecessary drugs. And we've talked about in prior lecture about unnecessary drugs in regards to the Beers criteria, the stop and start criteria. We talked about, why some drugs might be problematic in older patients. But there's about a couple general rules of what unnecessary drugs means. It's any drug that might be in an excessive dose. So for example, if somebody has renal impairment, is that drug appropriately dosed? Duplicate therapy also falls under excessive dose because if we're on two sulfonylureas, that's not necessary. Excessive duration, how long should somebody be on a medication and when should we think about tapering? Psychotropic drugs fall under this. Without adequate monitoring, that we're not evaluating, potential side effects like when do we repeatedly get liver function tests or when do we get an INR. So we have to use our appropriate clinical guidelines to make sure those are being monitored appropriately. And that's why in some states the pharmacists through collaborative practice agreements have the ability to order the appropriate labs to make sure they're being evaluated. Every medication needs to have an adequate indication for its use, to making sure that they do, and also making sure that there's no adverse consequences such as drug disease interactions, drug drug interactions. And so it could be a combination of all those. So the video following this, please watch FTAG 329 and go a little bit more detailed about what that is. The readings that I provide kind of give some guidance for this, but that is basically our role and responsibility as a consultant pharmacist, is really our primary focus besides the pharmaceutical side is making sure patients do not have unnecessary drugs. If you think back to, I've talked about in the past about the medication appropriate index. The MAI was a tool used in geriatrics 30 years ago as a study to evaluate pharmacists' impact on helping improving prescribing in nursing homes initially, and they've used this in the outpatient setting also. But the MAI, it was a tool, is a great clinical tool for you when you're first starting out as a pharmacist. That when you review a patient's drug regimen, you want to ask yourself these 10 questions. Does every drug have an indication? Is the medication effective for the condition we're treating based upon the guidelines and based upon the safety guidelines we know for that patient in terms of geriatrics? And that's where Beers criteria, start-stop criteria may apply. Is the dosage correct? Are the directions correct? Are the directions practical? Are there any clinically significant drug-drug interactions or clinically significant drug disease interactions? Is there any unnecessary duplication with other drugs? Is the duration of therapy acceptable? Is the drug the least expensive alternative compared to others? So you always want to be thinking about that when you're doing a drug regimen review. And if you think about those 10 questions, being able to avoid unnecessary drugs is going to play that role. So what are you expected to do this week? One, watch, after you watch this video, the video of FTAG 329. Please read the readings on FTAG 329. And then the other one is, it is due next Wednesday, the discussion questions. And the discussion questions are coming from a nursing home case that I have posted. And that nursing home case actually allows you to apply some of the things we've just talked about this week and last week of reviewing a patient. So the goal is that you want to review the case, all right, and I will tell you in the questions, I have specific questions that I want you to look at, identify possible potential unnecessary drugs, irregularities with this patient. And we'll be using this case when we do our live chat session. And I'll be sending out later this week a doodle. I know there's only 4 of you for this class, I believe. I don't think we have, it might be 5, I'm sorry. And I'll be seeing what the best date for our chat session will be in the coming weeks. And so I want to make sure I pick a date on a Tuesday evening that'll work for all of us. But what we'll do is when we do have this chat session, we'll be reviewing this case and kind of summating a lot of the different principles that I discussed. Thank you very much for your time, and if you have any questions, feel free to email me throughout the week. Thank you.